Ready? When a company decides to develop a generic version of a trade name drug, the company's experts in drug formulation figure out how to design it. They must ensure that the generic version is bioequivalent within a few percentage points to the original drug, that appropriate inactive ingredients are used, and that the generic version differs from its trade name counterpart in size, color, and shape, a legal requirement. The company must then seek the FDA's approval of the generic version. The company must conduct studies to determine whether the generic version is bioequivalent to the original drug. That is, whether the two drugs have virtually the same effect in humans. Bioequivalence testing involves determining whether the generic version releases its active ingredient, the drug, into the bloodstream at virtually the same speed and in virtually the same amounts as the original drug, and whether the generic version produces virtually the same levels of drug in the blood over time. For equivalence testing, a relatively small number, 24 to 36, of healthy volunteers can be used. In contrast, studies of new drugs are more complex and require a larger number of participants, and thus are much more expensive, because these studies must prove that the drugs are safe and effective. A generic version is likely to have some inactive ingredients that are different from those of the original drug. Inactive ingredients are added for specific reasons, for example, to provide bulk so that a tablet is large enough to handle, to keep a tablet from crumbling between the time it is manufactured and the time it is used, to help a tablet dissolve in the stomach or intestine, or to provide a pleasant taste and color. Usually inactive ingredients are harmless substances. Inactive ingredients can cause unusual and sometimes severe allergic reactions in a few people. One version or brand of a drug may be preferable to another. For example, bisulfites such as sodium metasulfite, which are used as preservatives in many products, cause asthmatic allergic reactions in many people. Consequently, drug products containing bisulfites are now prominently labeled as such. The FDA evaluates every generic version of a drug. The FDA approves a generic drug if studies indicate that the original trade name drug and the generic version are essentially bioequivalent. The FDA also makes sure that a new generic drug contains the appropriate amount of the active ingredient and that it is manufactured according to federal standards. Legally, bioequivalence of different versions of a drug can vary up to 20%, because for most drugs, such variation does not necessarily alter effectiveness or safety. However, actual differences between FDA-approved generic and trade name drugs are generally much smaller than the allowable 20%. Actual differences are typically only about 3.5% on average and rarely exceed 10% in any single study or bioequivalence. Bioequivalence must be proved for any new form of a drug. New forms include new dosage forms or strengths of an existing trade name drug product and any other modified form that is developed, as well as new generic drugs. Sometimes the form that was originally tested is modified for commercial reasons. For example, tablets may need to be made sturdier, flavoring or coloring may be added or changed, or inactive ingredients may be changed to increase consumer acceptance. Sometimes generic substitution is not appropriate. For example, some generic versions cannot be determined to be bioequivalent to the original drug because no standards for comparison have been established. These versions may not be interchanged freely for the original drug. Drugs that must be given in very precise
Is bioequivalent one word?
it's also 3 strokes.
It's 3 strokes.
Yeah.
Yeah, otherwise it's bioequivalent. I don't know whether it's such a word, but I wouldn't want to take a chance.
Yeah.
Oh,
I
you
was
read-
doing 3 strokes.
You read equivalent 1 stroke?
Huh?
You
No,
read-
2 strokes. Bioequivalent. 3 strokes. Bio is 2 strokes.
I do
So you write
bio-
equivalent 1 stroke?
Oh, equivalent, I write 3 strokes.
So it's 5 strokes. Bio is 2, equivalent
Oh
is
yeah,
3.
bioequivalent would be 5 strokes. Wouldn't bother me. I want to get it so I can read it.
Mhm.
Are you ready?
Mm.